Hi everybody, it's Dr. Sam Robbins. Today I want to discuss the main cause of non-alcoholic fatty liver disease, as well as simple and proven solutions, and a couple of them that you can implement right away. Now, today's talk about non-alcoholic fatty liver disease is because I've noticed that this is turning into a big problem. So much so that it's estimated that it affects 25% of the population. There's also alcoholic liver disease, which is caused by consuming too much alcohol. But people with non-alcoholic fatty liver disease do not consume any or just very little alcohol, but they do consume a large amount of other types of foods, and I'll tell you about that in a minute. Now, both the non-alcoholic fatty liver disease and the alcoholic liver disease will cause scarring of your liver, which can lead to cirrhosis, which can lead to liver cancer or failure. Just remember that your liver is extremely important to your health, both how you look and feel, your immune system, your mind, and hundreds of other important daily functions. So just because you're not drinking alcohol or taking liver toxic pills such as medications does not mean that you have a healthy liver, which is why I'm making today's video. So why is this, or should this be important to you? Well, first of all, there's no symptoms. In many cases, the non-alcoholic fatty liver disease, there are no noticeable symptoms. Maybe swelling in your belly or pain in your upper right side of your abdomen would cause concern. So would fatigue, and of course, an enlarged liver, which would need a doctor's exam. Thus, by the time you think or feel you have the non-alcoholic fatty liver disease, there's been just too much damage to the liver already. Remember, we want to be proactive. We want to prevent these problems. Remember, reversing liver damage is possible, of course, but it's just a lot more work and effort. Then there's also belly fat. Now, one thing I've noticed is that some people who have that belly fat, especially the harmful visceral belly fat, the kind that's inside your organs and causes your stomach to pop out like a beer belly or that pregnant look, these people tend to have non-alcoholic fatty liver disease. Now, there's no clinical proof of this, but this is just something I've observed dozens of times over the years. So the point here is that it's hard to tell if you have it. Now, doing a liver test doesn't always tell you that you have non-alcoholic fatty liver disease. The specific elevated enzymes, such as the ALT and AST, could be caused by, just regular stress or lack of sleep the night before you took the test. Exercise and muscle tissue breakdown causes elevated liver enzymes. Of course, so do taking medications, prescription drugs, and so forth. Again, not necessarily related to the non-alcoholic fatty liver disease. Okay, so what are the risk factors and causes of this? Now, studies have linked insulin resistance to be the strongest risk factor to having non-alcoholic fatty liver disease. Now, people who are most likely to develop insulin resistance includes people who are overweight and or lead a sedentary lifestyle. Basically, people who just don't move or exercise much. Now, other risk factors include diabetes, high cholesterol levels, and this also includes people taking statin prescription cholesterol lowering drugs. Also, if you have high triglycerides, use of corticosteroids, which a lot of inflammatory products can do that. Many oral prescription drugs, again, that I mentioned. Also, sudden weight loss may also raise your risk for non-alcoholic fatty liver disease due to the fast fat loss, due to your liver expelling the fat. Of course, so does poor eating habits. As you can see, there's lots of people have these problems, these risk factors, and this is why non-alcoholic fatty liver disease is so prevalent these days. All right, so let's talk about the solutions. Your primary goal here is that you must improve your insulin sensitivity and thus also have lower blood sugar levels, which means that you need to improve your lifestyle. This means eat better and move more. Now, if you're overweight, you need to slowly lose the weight. Again, eat better and exercise. The more muscle you have, the better your insulin sensitivity. The lower your body fat, the better your insulin sensitivity. And I know this is basic stuff for most people, right? Eat better and exercise more. But sadly, most people just don't do it. However, the main goal here is to improve your blood sugar levels. This means to remove all sugars, including fruit, which is not good for fatty liver. Also, do not drink any of your calories. This means no alcohol, no sodas with calories, no fruit juice, and so forth. only water, tea, and small amounts of black coffee. And there are two very important supplements I suggest you start taking. Now, the first is choline and inositol. Now, these are B vitamins. Take these specifically for the fatty liver reasons, all right, whether it's non-alcoholic or alcoholic induced. Both help dissolve the fat in the liver, especially the choline, but both work together, the choline and the inositol. Now, take 500 milligrams of both 3 times daily with food. Thus, it is going to be a higher dosage than the recommended, what's recommended on the bottle. But again, we're trying to take away the fat, so you need to take higher dosages. They usually come packaged together in one pill, and I don't care what brand you take. There's nothing special about choline or inositol, so get whatever is inexpensive. The next thing I want you to take, and I highly suggest, is you take a product called Blood Sugar Optimizer. Now, this is a product that I've taken myself for over a decade now. It's great at both improving insulin sensitivity, which is your primary goal, and also lowering blood sugar levels. And it also helps improve your A1C levels, which can help predict if you are pre-diabetic or diabetic. Now, Blood Sugar Optimizer contains numerous clinically proven ingredients at the correct clinically proven dosages. This is important. And not only can it help with non-alcoholic fatty liver disease and alcoholic disease, fatty liver, but it's also great for people who want to avoid or help, reverse potential diabetes, lose fat, and live a healthier lives by having healthy blood sugar levels. And there's lots of products I know that claim to help improve blood sugar levels, but I can honestly say that Blood Sugar Optimizer is the most complete solution. And I have a special link below this video to that Blood Sugar Optimizer page for more details, how the ingredients work, the clinical studies, the reviews, and so forth, plus free bottle offer options. So in summary, there you have it, right? You want to improve your liver and also improve your health in so many ways by improving your liver. This is especially important if you're overweight, if you have high blood sugar levels, if you have elevated cholesterol levels, if you do drink alcohol and or take prescription medications, all of which negatively affect your liver and your blood sugar levels. This can all be improved. Don't worry about it. Just do all the things that I suggested in today's video. Make sure you share the health and let other people know about this video and today's topic so they can benefit as well. Thanks for listening and have a happy and healthy day.